Hello, I'm Allan Hill. I'm Professor of Population and International Health in the Faculty of Social, Human and Mathematical Sciences. Most of my work has been in Africa and the Middle East, and particularly based in West Africa in recent years. This arises from the close collaboration we've built with the University of Ghana here through Southampton, where for many years we've been training doctoral students who've come to us who now occupy senior positions in Ghana. One of our graduates is the government statistician, and another is a senior lecturer in the Regional Institute for Population Studies. This collaboration continues with the exchange of doctoral students in both directions, master's students, and recently, in the last 2 years, the visit by students in the undergraduate program in population and geography, spending 10 days or so in Ghana on a project working with Ghanaian students on the other side. From a research point of view, we've built up this long-standing interest in health, particularly in urban health, and to this end, with colleagues in the School of Public Health and the Institute for Statistical Studies and Economic Research in the University of Ghana, we collaborated for the first study of this cohort of 3,200 women who've been looked at both from the point of view of home interviews but also for medical examinations, and we followed them in a second wave in recent years. We continue to learn a lot from this study, recognizing for the first time the extent of the obesity epidemic in West African populations. Generally speaking, women in Accra are as large as they are in this country, which is amongst the most obese in the Western Europe. Following on from this large-scale study, we have been interested in trying to undertake some intervention studies with Jim Wright in the Department of Geography. We've been doing a trial of the subsidy of sachet water in order to reduce the diarrheal disease mortality and morbidity in children under 5, because with the growth of the population of the city of Accra, only about 40% of households have access to safe drinking water. Other studies that are continuing include measurements of health, looking at the ways in which self-report and independently estimated measures of health correspond. And there are other work on the time use in health, the impact of working mothers on their health of their children, as well as studies of health and well-being and fertility in the slum areas of Accra. Through this network of exchanges built up through time, we have the ability to provide the framework for overseas work in a safe environment through our colleagues at the University of Ghana.